Hi there, I'm Dr. Susie Houston. I am a doctor of nursing practice, adult gerontology nurse practitioner, and a certified diabetes care and education specialist that works at ECU Health Lifestyle Medicine Clinic here in Greenville, North Carolina. I have been living with diabetes myself for more than, oh gosh, the years add up, but at least 40 years. And so I have known about diabetes for many years. And as a diabetes care and education specialist, I've been helping people to manage and take care of their diabetes and help folks become the best manager of their diabetes. Because think about it, if you are living with diabetes, type 1 or type 2 or type in between or LADA or MODI, then you are the manager. And it's really important that you are taking that role very seriously because when you think about it, you live with your own diabetes 365 days of the year. There's no days off, no holidays. And you maybe meet with your provider maybe every 3 to 4 months, maybe more if things aren't quite in shape or where you want them to be. So think about as a person with diabetes and as a self care manager of your own diabetes, you are your own nurse practitioner. You are your own provider. You are your own pharmacist because you are doing your medications every day, a couple of times a day, even. You are your own chef. You're your own dietitian because you decide what you're eating or not. And you decide what kind of drinks you're doing on a day in, day out basis. You are also your own nurse because you're probably helping yourself, helping get your medications ready, might be delivering your own insulin or taking your pills as directed by the provider. So you've got a lot of things going on. So, part of these sessions of ECU Health Diabetes Meets Lifestyle Medicine is a series that I thought would be important to our community to help people get on board with being a successful diabetes manager, so that you have least amount of complications and you do as best you can do with what you've got on a day in, day out basis. With the ECU Health Lifestyle Medicine Clinic, we work towards helping people be those great self care managers. And with that, we want to make sure people are thinking about healthy coping. This is one of the seven self care behavior topics that needs to be addressed. And think about it, diabetes could affect A to Z, right? And everything in between. And depression and burnout, they pop up at the top. Sometimes people are full of anxiety because they don't know what to expect or what's going to happen. And so when we think of this self care behavior of healthy coping, you know yourself better than anybody. And if it is that you need some help or guidance or support to help figure things out, how to live and deal with the day in, day out management of your own diabetes, then maybe our clinic could be of help for you. Then you also have to think about your medications. What are the names? When do you take them? What are they for? Sometimes we find out that people are on a couple of medicines that maybe the dose could be lowered when they start working on lifestyle medicine, or maybe they could be readjusted and narrowed down so that you are taking less medicines when you build up your exercise, which is another hot topic for self care behaviors and management. Because if you're not doing any sort of physical activity, maybe today's the day. So that's another topic to be thinking about, being more active, healthy eating. We all love to eat. I think we do. But I think after sometimes you meet with somebody that's helping you figure out a new game plan, you maybe initially think, oh gosh, what are they going to take away from me? When really we are here to help you figure out what will work in your diabetes plan or your pre-diabetes plan or even your weight loss journey so that we can help you figure best plan for your tastes, your family's taste, because you don't want to make two different meals, right? And also your budget, because we don't want people to think healthy eating means very expensive and it's going to taste bad and nobody in the family is going to like it. So we want to make sure we're helping with those ideas. The other part would be monitoring. That's important. If you do have diabetes or even pre-diabetes, you want to make sure you know your numbers. It's hard to keep up with everything, but imagine if you poke your finger with your glucose meter or monitor, then you want to make sure these numbers are valuable and that they mean something. Or if you just check once in a blue moon, all you've got is one little dot of blood and it just gives you this one number. And you could be going to see an endocrinologist, that's the diabetes specialist, or maybe somebody like me. And that one little number out of a month doesn't give us enough details to even appreciate or understand how well things are managed for you and your diabetes. So, monitoring is important. Reducing risks is another self care behavior because we know when people have diabetes, they are at risk of complications. And the usual suspects are people can go blind if their diabetes is uncontrolled for great lengths of time. There have been amputations of lower extremities, usually a toe, a foot, a leg, sometimes both. So, amputations could be a severe complication to uncontrolled diabetes management. So, we want to make sure we're on top of those things. Kidney disease and dialysis, heart disease, heart attacks, strokes, everything in between from head to toe, there could be a possible complication. So we are trying to reduce the risk. So when you come to a clinic like ours, we're here to help support you and help in areas that might need attention. So we've got reducing risks for sure. We want to make sure everybody keeps their vision as best we can, make sure that kidney function is always working, and make sure people come into this world with 2 feet. We want them leaving this world with 2 feet. That's important. And in this day and age, we should be helping people prevent amputation of any kind. Also, problem solving. Think about it at life in general. We could have a problem just as far as getting to our provider's visit. That could be an issue. Maybe we've lost a job and we can't afford the medicines we used to. Maybe we just have challenges with we don't know which medicines we're supposed to take and when. And it's important. We could also like that idea of do we buy groceries that we talked about with the dietitian or do we pay the electric bill? Those are problems. So then when you add in diabetes, that just kind of adds fuel to the fire of how we manage and handle problems. If there are certain issues that you have, make sure that you share it with your provider at the next visit so that they can help you figure out, strategize, connect you with resources. And that's super important that we ask for help so that we can do things a little differently and make sure that we're taking best self care of our diabetes or pre-diabetes. Now, with lifestyle medicine, similar properties that go along with that is we want to make sure that people are eating in a healthy way as best they can with what they've got in their local area, have increased physical activity because we know physical activity helps improve blood pressure or blood sugar, weight, our mood, healthy joints and bones. And imagine if we could be emotionally well because we do a walk for 15 minutes every day. Managing stress is important with the pillars of health and lifestyle medicine, relationship building and maintaining, improving our quality of sleep, and avoiding risky substances. Now, in some cases, people are not smoking or drinking alcohol, but they are drinking a sweet drink. And so, if that's your risky substance, that might be something that you think about today to change that up. So, those are the two components that we help that helps merge diabetes care and management. America or the Association of Diabetes Care and Education Specialists, 7 self-care behaviors, and then we've got the lifestyle medicine 6 pillars of health that kind of go together to help people do and manage and deal with diabetes in their own personal space and that they have control over. So just remember April, it's the time for April showers to bring the Mayflowers, but hopefully everybody is starting to see some blossoms and blooms in their garden or their neighbor's garden. And also maybe seeing some things that are popping up at the farmer's market or in your own garden or your neighbor's garden. And maybe you can collaborate to share all the good veggies because at one next point you'll be saying, oh, I missed the strawberry season again. So they are growing locally and I made a point of finding, oh, excuse me, I'm jumping with my little notes. Just because with the Sparks people, they talk about days to greener lifestyle. And for April 17th, today, it's talking about eat seasonally. So seasonal foods are fresh, they're more nutritious, plus they have not traveled as far to get to your table, and they're rarely imported from faraway countries. So that's important because we live in a great area. North Carolina has fruits and veggies and the Got to Be NC Agriculture, they have this great chart and it lists what's in season so that you can kind of pay attention to that so that you know what's available in your area and when. And right now, it turns out asparagus, broccoli, collards, greens, herbs, lettuce, mushrooms, mustard greens, peanuts, radishes, romaine lettuce, spinach, strawberries, sweet potatoes, and turnips. They are in season for April. So next time you're in the grocery store, look on the label to see where it's come from. And if it's got NC on it, that'd probably be a good choice. And I hope it's a little cheaper than something that's come from maybe California or another country. So just be on the lookout for that. You can always go to do a Google search and put in got to be NC agriculture and type in what's in season and you'll find the list for the whole for the seasonal fruits and veggies. So Earth Day is April 22nd, and that is coming up. So it's the time to enjoy fresh air, make contact with soil. Maybe you're planting a garden because you've heard me before. And now's the time to get a bucket, get some dirt, and a few seeds from the dollar store and start planting. Think about if you are on the lookout for seeds or flowers or plants, think about wildflowers that grow well and they're native to North Carolina so that that can help, excuse me, attract bees and butterflies in our neighborhoods and backyards. Um, Bring nature into your garden and conserve water. Sometimes we get a lot of rainfall, and filling a bucket or two can help support watering our gardens as well and save on our electric bill. So, with April comes a few healthcare topics, and one is make sure you know that April is Stress Awareness Month. So, just think about things that can help you relieve or reduce activities that cause stress or improve your activities to help decrease your stress. Could be listening to music, could be looking at Mother Nature, could be aromatherapy, could be exercising, movement, and could be just singing a song or laughing. So those things can all reduce stress. Also, Alcohol Awareness Month is in April, and just consider what a drink is if you do drink alcohol. And we're talking one drink is 12 ounces of beer, 8 ounces of malt liquor, 5 ounces of wine or distilled spirits or liquor is 1.5 ounces. So that's considered one drink. Typically, it's considered that appropriate alcohol intake is one drink for ladies and no more than two drinks for men a couple of days of the week. Also, April is National Autism Awareness Month, and just be thinking about together we can make a world for those with autism. And it's inclusion rather than exclusion. And with diabetes and prediabetes, they are big chronic conditions. Diabetes, you've already got it. You've been diagnosed. So if you've got it, chances are it could be in your family genes. So that means a family member, brother, sister, mother, and your children are at risk for type 2 diabetes. So be thinking about prediabetes. This is a great time when you can help people that if they realize their provider said they have prediabetes, which is an A1C that's above 5.7, but not above 6.5, then that puts them in that prediabetes range. And that's where lifestyle medicine can really fit in to help stop, delay, prevent type 2 diabetes from coming forward into their world. So think about things such as food as medicine, exercise as medicine, and how what we eat can improve our mood, our weight, our blood pressure, sugar, cholesterol, joint pain. And what we do from a physical activity standpoint can impact all of those as well. So, what great medications with no copay and next to no side effects, but good effects. And so I think that's awesome that what you do can have an impact on whether you need more or less medications from the pharmacy. So we have visits with providers here at the Lifestyle Medicine Clinic. We also have registered dietitians, lifestyle coaches, exercise physiologists, and behavioral health counselors. And these are all important team members of the Lifestyle Medicine Clinic. So prediabetes is a big deal. There are more people in our world, in our state, our country, in our local area that have prediabetes, and that's that A1C that's between 5.7 or 6.4%. And maybe they have a fasting number that's between 100 and 125 when they've gone to the provider. So we have great programs across the state that can help, and they are free. You just have to find them or know where they are. And you can call our front desk to find out, 252-847-9908, or go to Diabetes Free NC to find out when the next program is available in your area. It may be in person or it may be in a virtual setting. So, if you are far away from the certain areas that they have it, you could still join. I know some people that have been in my program. I had somebody that was very persistent, and she called from Texas, and I said, "Oh, I'm sorry, this is only a program for North Carolina." But then when she called again and I had space, I said, "Oh, come on." And so I had a lady as far away as Texas joining the program. So keep in mind also at our clinic, we do offer assistance with diabetes prevention, pre-diabetes, and diabetes type 1, diabetes type 2. And sometimes people might find out that they have something called LADA or MODI. And so we offer assistance with help with that with our team. We also have a program called Exercises Medicine, and there is a charge. It's an 8-week program, but you can find out more. So if you are a bit of a couch potato and you want to start somewhere, this might be the place to start. So you could call and find out a little bit more about exercises medicine. We also have in the future cooking demonstrations and cooking classes. Now, some of those are free, the cooking demonstrations, and some classes there will be a charge. And we are in the process of working on expanding the classes and availability. And if you are interested in the cooking demonstrations or classes, you can always ask to be put on a wait list by calling our number and speak to the ladies at the front desk, which is the 252-847-9908. We have a sweet talking diabetes support chat. And so for 2023, and our next session will be April 19th, and we're going to be talking about a spring tune up and discussing head to toe complications and what you can do to do your tune up and keep things going in the right direction. And that will be here at our ECU Health Lifestyle Medicine Clinic in our classroom. And it goes from 12 o'clock to 12:45. Lunch is not provided because it is a little short session. It's very informal. You just need to show up. Bring your special low calorie, low carb drink and just sit in, and you can chat with others that are dealing and managing the same thing. And sometimes you can be sharing tips, and then in other cases you might pick up a few tips to help manage your diabetes really well. And that is free. Like I said, you just need to show up. And that's April 19th, 12 o'clock to 12:45. So if you or someone you know has prediabetes, diabetes, not sure if you have 1, 2, LADA, or MODI, and want to learn more to help manage it so you're the best self-care manager of your own diabetes, then maybe you give our clinic a call at 252-847-9908. My email, just if you had any other questions, is susan.houston@ecuhealth.org. And please make sure you're staying well hydrated, drinking lots of 0 calorie, 0 carb drinks. Best one ever is my favorite, water. I know sometimes it can get boring, so I want you to be thinking about, what could you add to your water today so you can jazz it up and give yourself a treat? You might want to be thinking about, oh, just pick some strawberries recently, wash them off, slice them up, and infuse them into your water. That would be a nice way. I just realized I got a big bunch of mint in my yard, and it comes back every year. Mind you, it can grow a little wild, and I don't mind a little wild. Some people might. So if you were going to grow mint, and I tell you what, you can get all sorts. There's spearmint, there's peppermint. I just got last year chocolate mint, and it's starting to grow. And so you can take those leaves and you could infuse them into your water so that you have got a hint of flavor. You jazz up water that you might think is boring, and then you might want to drink more because you've made it a little bit more exciting. And the good part or great part about water is there's 0 calories, 0 carbohydrates. It's not going to impact your blood sugar or your waistline. So it's a win-win when you drink water. So thank you so much for your time. I'm Dr. Susie Houston. I'm with ECU Health Lifestyle Medicine Clinic. Please contact us if you're interested in diabetes prevention, diabetes care, diabetes management, or lifestyle medicine services that could help you with your chronic conditions. Thank you, and I'll see you next time.